Hi, and welcome to Butte Home Health. We're truly honored to be part of your care team. So, what is home health care? Simply put, it means getting professional health services right in the comfort of your own home. Whether you're recovering from surgery, managing a chronic condition, or just need a little extra support to stay safe and independent, we're here to help. At Butte Home Health, we believe that healing happens best at home, surrounded by familiar things with the people you love nearby. That's why we bring skilled nurses, therapists, aides, and support staff straight to your doorstep. We've been serving our community since 1984, and we take pride in offering care that's compassionate, reliable, and tailored to your unique needs. From the very first visit to the last, we're here to make sure you feel supported, respected, and truly cared for. Our mission is simple: to provide excellent care with a personal touch. When you're admitted to Butte Home Health, we'll provide you with a yellow folder filled with important information about your care. This folder includes your visit calendar, medication and vital sign tracking sheets, emergency contact information, instructions for safety and fall prevention, your rights and responsibilities as a patient, helpful community resources, and much more. Please keep this folder in a visible, easy-to-access spot in your home. Any member of our care team who visits will need to review and update the information inside. This folder is your go-to guide for staying informed, safe, and involved in your care. Feel free to ask any questions at the end of this video. Here's a quick overview of what you're signing. Consent for services. You're agreeing to receive care from our team in your home. This includes nursing, therapy, and other services listed in your plan of care. On the consent is insurance authorization information. You're allowing us to bill Medicare or your insurance on your behalf. Most Medicare patients don't have any out-of-pocket costs, but if there is a copay with your insurance, it will be clearly noted. Release of information. This allows us to communicate with your doctors, hospitals, or other care providers to coordinate your care and keep everyone on the same page. Photo authorization. We'll take a photo of you for identification purposes, and we may take pictures of wounds or skin conditions to track healing and share with our wound care team if needed. Blood testing consent. This allows us to perform necessary blood tests and ensure safety for both patients and staff during any blood draws. Copies of everything you signed are in your yellow folder for your records. If you have questions about any form, your nurse will be happy to explain it before you sign. Helping you stay organized and involved. Inside your yellow folder, you'll find a calendar that outlines your upcoming visits and the care you're receiving. Here's how to use it. Place it somewhere visible, like your refrigerator or next to the phone. Our clinicians will write their names, visit dates, and what they'll be helping you with. If your schedule changes and you get a call from us, please update the calendar to reflect the new visit info. This calendar helps you stay involved in your plan of care. You'll always know who's coming, when, and how each visit supports your health goals, so you feel informed, prepared, and included in your care planning. It's a simple but powerful way to keep you, your loved ones, and your care team all on the same page. Call us first. This is your health, your safety. We're here to help. Inside your yellow folder, you'll find a handout titled Call Us First. This is one of the most important tools we provide to help you stay safe and avoid unnecessary hospital visits. Why call us first? Our main goal is to keep you comfortable and cared for in your home and out of the hospital unless absolutely necessary. Call us first if you experience trouble breathing, increased coughing or swelling, sudden weight changes, pain that isn't managed with your current medications, a fall, even if you're not hurt. We have nurses on call 24/7, 365 days a year. A nurse will triage your situation, and if needed, a member of our team will come to see you, often the same day. For emergencies, always call 911. We are not an emergency service, but we are your first step for non-life-threatening concerns. This handout is a quick reference to help you know when to reach out and how we can respond quickly to keep you safe and supported. Prompt Care Clinics. A smart alternative to the emergency room. In your yellow folder, you'll find a list of local prompt care clinics. We strongly encourage you to use these clinics instead of the ER whenever possible. Why prompt care? Prompt care clinics are designed to treat common, non-life-threatening health issues quickly and efficiently. They're a great option for things like urinary tract infections, UTIs, minor infections or rashes, cold or flu symptoms, mild injuries or sprains. Here's the difference. At prompt care, you're typically treated the same day and sent home with medication. At the ER, you might be admitted, even for something simple like a UTI, which could result in a 3-day hospital stay and delays in returning to home health. Prompt care saves you time, reduces risk, and helps keep your care on track at home. If you're ever unsure where to go, give us a call. We can help guide you to the right place. Here are some simple steps to stay safe and independent. In your yellow folder, you'll find a handout all about making your home safer and reducing your risk of falling. Falls are one of the most common reasons people end up in the hospital. But the good news is, many falls can be prevented with just a few small changes around your home. This handout includes helpful tips like starting a regular exercise routine. Your therapy team can help. Reviewing your medications with your nurse. Getting your vision checked regularly. Removing hazards like throw rugs, cords, or clutter. Making sure your home is well lit, especially at night. Installing grab bars or using assistive devices as needed. There's also important info about fire safety, emergency exits, smoke detectors, and more. Use the checklist to walk through your home and make adjustments, either with your nurse, a family member, or on your own. Your home should be a place of comfort, not a risk. This handout helps you make sure it stays that way. Utility support resources. Because staying safe at home means staying connected. In your yellow folder, we've included a utility support handout with helpful information if you're having trouble paying your bills for electricity, gas, water, telephone services. This handout lists local and statewide programs, like those through PG&E and telephone providers that may offer discounts, payment plans, or emergency assistance. These programs can help you. Keep the lights and heat on. Stay connected with your care team and loved ones. Avoid interruptions in essential services. You don't have to face these challenges alone. If you need help applying, let your nurse or case manager know. We can connect you with a medical social worker for extra support. Keeping you and the environment safe. Your yellow folder includes important handouts on how to safely dispose of old medications and sharps, like needles or razors. Medication disposal. Please don't flush medications down the toilet. Flushing can harm our environment. Medications are now being found in our fish and waterways. Here's what you can do instead. Take unused meds to a designated drop-off site, locations listed in your handout, or safely dispose at home using a Ziploc bag with water and dish soap, then throw it in the trash. Mix pills with used coffee grounds or kitty litter before discarding. Sharps disposal. Never throw needles, syringes, or razors in the regular trash. Your folder includes a list of approved sharps drop-off locations, such as local landfills, like in Glenn County, fire departments, like Hamilton City Fire. Use a proper sharps container and drop it off safely. This protects your household and your community. Everything you need to know about your home health services. Inside your yellow folder, you'll find a patient guidebook. This is your go-to resource for understanding your care, your rights, and the services available to you. Here's what you'll find inside. Service information. Details on the types of care we provide, including nursing, therapy, social work, and specialty services. 24/7 availability. Learn about our on-call nursing team, available 24 hours a day, 7 days a week if you have a health concern outside of regular visits. Your rights and responsibilities. Know your rights as a patient and your role in helping us provide the best care possible. Care planning and goal setting. We work with you and need your compliance. It's important to keep appointments and follow the clinical recommendations from your care team. Need help or have a concern? We're here to listen. If you ever have a concern about your care, contact our administrator, Robert Love. He can be reached at 530-895-0462. Robert is dedicated to patient satisfaction and will ensure your concerns are addressed with care and respect. If your concerns are not resolved, you'll also find the state complaint hotline number in the guidebook for additional support. Please take time to review your guidebook and remember, you're never alone on this journey. We're here to help every step of the way. You'll have your case manager and other clinicians' phone number. It's even printed right on their business card. And you're welcome to use that number for non-urgent things, like asking a question, giving an update, or scheduling a visit directly with them. But if something urgent comes up, or if you're not sure what to do, please call our main office line first. Here's why. Your clinician might be off for the day on vacation or with another patient and unable to answer. The office has the most up-to-date schedule and access to your full care information. And most importantly, our main line is monitored 24/7. No matter when you call, you'll always reach a nurse or care team member who can help you right away. So here's the number to keep handy. Butte Home Health, main line 530-895-0462. We're here for you 24 hours a day, 7 days a week. You'll find this number right on the front of your yellow folder. Your safety is our top priority. So remember, use your clinician's number for routine things, but always call the office first for anything urgent. We're here to make sure you get the care you need exactly when you need it. As part of your experience with Butte Home Health, you may receive a home health cap survey in the mail after your care has ended or even possibly during your care. This survey comes from an independent agency and asks about the care you received, why it's important, helps us understand what we're doing well, identifies ways we can improve your experience, ensures we continue providing safe, compassionate, and high-quality care, striving for excellence. At Butte Home Health, we're committed to providing care that meets the highest standards. Your comfort, safety, and satisfaction are our top priorities, and your feedback helps us grow and serve you better. If you get a survey, please consider filling it out. Your voice matters. Thank you for letting us be part of your care journey. Thank you for choosing Butte Home Health. It's our privilege to walk beside you and your loved ones with compassion, respect, and care.